I think before the discussion actually gets started, I would love to answer clarifying questions that folks have. And so I think there have been a number of those in the chat, Udi, but if you or Devlin or Zachary or anybody wants to either call out some of the questions that have come up, or if folks have clarifying questions about the actual funds, please feel free to ask those first, and then we'll get into our discussion. And you can raise your hand, you can drop questions in the chat, whatever you prefer. I see a question about how to apply to be on the advisory body. We are not quite at that stage. I think we just want to know whether or not you think there should be an advisory body, and we would build towards what that could look like. Any other clarifying questions about this work?
I have a question. This is Annie. Because this is federal funding, is there certain things that you foresee, like community-based organizations in rural areas trying to or needing to have in place to, I'm sure that's going to come with a whole description, but I'm hoping that there's some considerations in terms of what some of us have experienced when we're getting funding through just even, state, like all the reporting and all that. And I'm guessing that federal funding is going to be even, more of a challenge, which makes it hard for some community-based organizations to sign on and say, yeah, we want to be part of this, we want to apply, when sometimes it can be more work for us to do that. And at the same time, like the need for the funding and some of this work is so needed in our community. So just I'm hoping that there's some considerations into how to ease the burden and still meet the requirements, but also being very upfront with those requirements, so that community-based organizations can decide, and hopefully it works for more people to participate. Thank you.
Yeah, thank you for that comment and question, Annie. I agree with you about the potential burden of federal reporting. We are going to do what we can at the state to keep that in check wherever possible. We know that some of the requirements will be related to metrics, and the state gets to determine or gets to propose in our application what those metrics would be. We are hoping to use existing metrics that are already collected. That is our goal, as opposed to creating new metrics or new reporting for this program. But we'll see. And then we're also going to do what we can to reduce administrative burden when we do get to next year and look at RFPs or RFAs, thinking about maybe how organizations could apply together. We do have a little bit of time on figuring out some of those design questions, but it's great to hear that up front and center about the reality of needing the work to actually apply and maintain funds is its own body of work.
Yeah,
Okay.
hello, this is
Yeah.
Bernardino. Um, I just wanted to mention that it would be really good to see something in terms of these initiatives and or services in the rural regions that are mainly focused, youth services focused. We tend to put them on the back burner always, and always have a struggle with trying for parents to really get their children's services, whether it be for mental health or addictions. And that has been very lacking in the state of Oregon. So I'd like to see something specifically mentioning youths in specific and not just in general, because the tendency is to focus on adult services always. And I think it would do a great service to really make it youth focused.
Great. Thank you for that comment. Really appreciate that. I endorse and support that as well, and the necessity, especially in rural Oregon, and in making sure that we have specific initiatives and workforce and each of our areas focused on kids. We do have plans to do that. We have some of our colleagues listening in as well that I'm sure are happy to hear that ask as well. And I see some hands raised. Heather?
Hi, thanks, Steph, and thank you, team. This is a really well done presentation. I really appreciate the thoroughness and all the results and everything. Just a couple clarifying things. I did see on that, as folks know, I'm from Oregon Council for Behavioral Health, and so I have behavioral health focused questions. One on the column for which of the subject areas things are. The behavioral health I saw was not in the collaboration, and I just would want to encourage that also be noted, because I know many folks who submitted information, and I know many programs in our frontier and rural communities, behavioral health do have shared and co-located staff and operating programs. So to make sure that that's reflected in the collaboration piece, I think is something not to let fall off the table. So thank you for that. And then the other, on that note, a suggestion, having worked on many rural collaborative things, I've lived in Oregon my whole life, all around the state, is when the disbursement plan, this is just something to consider when you do that RFP, to include that the participants all receive a stipend. It's especially in rural communities, it's really often some of the smaller, like if a larger organization gets the grant, some of the smaller folks often just are expected to come, and it would be really important for them to have a stipend to cover the cost of the time of their participating in the planning. That's a really super helpful methodology, and just ask that you consider thinking about that in the application. Thank you.
Great. Thank you, Heather. Seeing so many supportive reactions to what you've shared, and appreciate that. Colleen.
Hi, thank you so much for this presentation. It's super helpful. It's cool to see how Oregon's approaching it. I just wanted to back the comment before. I think particularly as there's such a focus on controlling cost happening right now, which is of course necessary, I think that's just leading to a lot of like downstream focusing on services for downstream cost. And so what I think is so great about some of the priorities that the federal government has established is like, how do we establish health? And health is established prenatally, as you highlighted, and within children. So making that potentially a subcategory within your groups maybe will help you kind of honor that. And also thinking about kind of lack of duplication, which I saw them say. So we've, as a state, invested a lot in inpatient behavioral health services and expanding that gap, but I'm not sure we've invested in some of the preventive behavioral health services. And how to kind of enhance the existing workforce to be able to provide those services.
Great. Thank you for that. Appreciate that, Colleen. I think I'm seeing a couple of other questions that I will highlight, but then I think we can move into discussion after that. So there's a clarifying question about how we would actually provide some of the supports when they are covered. So things like community health workers or mobile health services. We are going to be creative in how we apply and try to identify, maybe it's the investment in the mobile clinic, for example, not the actual services delivered through the mobile clinic, that we could apply for funding to support. Or maybe it is enhanced services of community health workers that are not currently reimbursed in Oregon. Postpartum doulas, for example. It could also be training to support community health workers and paying stipends, as Heather mentioned, other ways that we can try to work around some of this. I did want to mention something that I've neglected to mention earlier related to workforce, and just wanted to share that there is a requirement in this that if we are using funds for specific recruitment and retention investments, that there is a 5-year commitment of those folks who are receiving those commitments to continue to work in rural Oregon. And so just something else that we need to track and be thoughtful about how we are setting those up to make sure that it aligns with the needs of the community and the needs of folks who may be in those fields. I know Devlin, Udi, Zachary, John, you're all actively working behind the scenes. Are there any other clarifying questions that we think would be valuable for us to talk about before we get into other discussion questions?
Yeah, there was a question about where folks can find information about the state's RFP, should the award be awarded to the state. So all that information will be made available on our website, which has been linked in the chat, and I can link that once again. So any updates with regards to the state's application, as well as activities that follow the application, including the RFP, will be made available there.
Thank you, Udi. And I also see a question about how we're defining rurality. We can share that with you all. Maybe we'll be able to get to a link before the end of the session. Otherwise, we can we'll put some of these FAQs together as well. This is a definition that is included in the Notice of Funding Opportunity and combines a couple of existing definitions that are common with some of those additional factors that we've talked about. Okay. Rick.
Thanks, Steph. Rick Blackwell with Pacific Source. I was just curious if the initiatives were run through kind of a sustainability filter, thinking through whether this fund exists or not in a few years, if the investments can help kickstart some initiatives that can be more self-sustaining in the midst of federal uncertainty.
Yeah, I really appreciate that question. It is a factor, I think, in how we think about this in an ongoing manner. We are trying to put our best foot forward with some of those sustainability considerations in our application. So I think you'll see some of that reflected. Our initial investments in that early phase 1 may be more focused on stabilizing with a goal towards that sustainability in later years. And I think you're right to point out the risk. As this is a cooperative agreement, there are, if we use funds in ways that we didn't quite describe that way, and the federal government isn't, in our conversations, they're saying, actually, we don't like what you've done here, and that's not what we thought you were going to be doing. They can actually even claw back funds. So we are trying to be really cautious with what this would look like and ensure that we're not creating something that will then be lost in future years. Okay. Great. So feel free to continue to put any clarifying questions if you have them on just like the structure of this and the timelines, those types of questions. But I would love to move into some conversation and discussion around can we go back one slide for a second? Initiatives that are higher or lower priority for you. Are we missing anything you'd expect to see included? I've seen lots of great information in the chat pointing out some of your answers to these questions already. And then when we think about next year, once we have funding, once we've applied, what challenges do you foresee in implementing some of these activities in your local or organizational context? And then certainly, do you have initial reactions as it relates to an advisory body around this? Do you think that there's maybe an existing group that could provide these supports? So would love to hear discussion. Feel free to raise your hand or put more information in chat. And then if we go to the next slide, we'll just share that we do have a survey that you can, think about this a little bit more as well. And respond to what you've seen in this slide deck and in the conversation today. I can assure you we really are trying to reduce burden on folks at this stage, knowing that we're just in application stage. And so really trying to, everything that you're sharing today is going to be captured. Don't feel like you need to answer the survey or else we're not going to, have registered what you've shared. But if you do want a little bit more time or you want to share this with others or folks who weren't able to attend, the survey will really just be your opinion on each of these proposed initiatives, how you think it will impact Oregonians, ranking some of these initiatives by impact that you see, and will help us revise, prioritize within the framework that we've shared today. Great. Okay. And I see some great comments in here already. Would like to see a focus on independent rural health clinics being prioritized in funding. We currently don't get any federal funding. Thank you, Jennifer. I was able to attend the Rural Health Conference last week and heard lots about the importance of being able to support our independence. Recognizing, let's see, local CHIPs and so these are community health improvement plans. Would like those to be included in any advisory planning, as well as the emerging statewide shelter work group that's been forming under House Bill 3644. An advisory body, so we got some thumbs up on having an advisory body and would like to see representation across all areas, RHCs, behavioral health clinics, FQHCs, etc. Thank you, Anne. We got some great comments in the initial survey from Comagine. Behavioral health is a high priority for emergency departments, primary care, long-term care, schools, employers, etc. So building capacity of providers, supporting and growing current initiatives, workforce supports, all are important to include if possible. Thank you. Okay. Please feel free if folks want to raise their hand or comment about our initiatives or any reflections so far. Really welcome that. I'll continue just in the meantime to share some of what we're seeing in the chat in case folks are listening. A question about including eye care and vision care providers and the gaps that exist in FQHCs as they're not included currently. And I see that UD did respond about including this in our first initiative around healthy communities and preventive care. And so would capture this input and refine our application. Okay. Questions about satellite data. And I don't know, UD, could we put the email address, or maybe this is at the end of our slides. Let's see. Yeah, if we can go to slide 33, please, John. This is our email address, rhtp@oha.oregon.gov. Yes, Nancy.
Hi, Steph. Thank you. I just two things that I wanted to comment on that maybe you might think about including. One is, just wondering how you're thinking about all the infrastructure that's been built around health-related social needs will be continued in rural communities, specifically supporting small and medium-sized community organizations that have done a lot of work in like connecting with other community organizations and also like care navigation and how that could potentially be like continued and supported through this work. And then the other thing is too, like, so we have a lot of rural partners around the state, and very often when grant opportunities go out from the state, either we hear from them, either they don't have the capacity to do the writing of the grant or the resources to apply. And sometimes when they do, then they feel like they're competing with other rural partners in their communities for the same grant funding. So just a request and kind of maybe thinking about like how to help organize some of the rural communities and putting applications together, and making sure we're like reaching all parts of the state with those opportunities.
That's great. Thank you. I think that has been one of the other questions, is just thinking about how we can support that distribution and ensure that there's that it is really reaching all parts of rural Oregon. It's great. And I know, Nancy, you had some exciting activities that you shared about last week at the Rural Health Conference, and some really promising practices in rural Oregon too. So, thanks, Orphan, for the work that you're doing, and lots of others on this call. Really, just some fantastic work that we're excited to, build in as examples of the type of work that can be done in Oregon. Great. I linked the follow-up survey there in the chat. And I know we do technically have another half hour scheduled, but we are hitting the lunch hour. So would just welcome you if you have any other thoughts. I'm sure many of you are just here to learn, and to get a sense of where we're at with this work right now. But really, if you have anything else to add, this is a very fast turnaround. As I said, we're going to be working on application materials and finalizing in the next really 2 weeks, 2 to 3 weeks. So if there's anything else you want to be sharing, please either send an email or feel free to come off mute. It would be great to hear from you.
Steph, this is Devlin. Just want to reiterate to everyone that we are capturing all the questions in the chat and what we've heard. And so please just stay in contact with us and keep an eye on our webpage, and we'll make sure that you get answers.
And yes, we'll be sharing a recording of this webinar as well as the one that occurs tomorrow in the evening, recognizing that, hoping to hit different times and days of the week that folks would be able to join. You're also welcome to share that survey much more broadly, if that's helpful. Okay. And I see the question about rural. So I will just share that we are using the definition that comes from the Notice of Funding Opportunity. I don't know if we'll be able to scramble to get that right now, but it is included in the Notice of Funding Opportunity, and it is a combination of factors. Let me actually see. If you don't all mind holding, should really have some hold music. Okay, this is not going to be helpful for Danielle. I see your question about the definition of rural. So this is what CMS responded to that question with. I'm going to put it there, but doesn't probably answer your question. I will note, however, that the Notice of Funding Opportunity does give us a lot of space with where we're putting the funds. So I think we are focusing on supporting rural Oregon, but don't need to necessarily be constricted by some of the definitions that CMS may use. That just goes into factoring how we get scored. But we can certainly be broad in what that looks like. I will reiterate, though, our goal is to be supporting rural Oregon with these funds, and the funding should be all focused on getting out to our rural partners. Okay. Well, I think folks are starting to drop off. I will hang on for just a few more minutes in case people are still chatting and are writing things up. I see a great comment here about some of the behavioral health impacts. Thank you, Samantha. Definitions posted by Oregon Office of Rural Health. We are working very closely with the Oregon Office of Rural Health on all of this application. And so I don't want to give a definitive answer there yet, but thank you for sharing the link there. And we are working really closely with them on all of this. Great. I'm just imagining people getting out all their typing. So I don't want to artificially cut this off, but feel free to jump off if you have gotten what you need out of this. And we will continue to share on our website as well.